about the untold details of blood transfusions. People aren't made aware of the fact that when you have a blood transfusion, you are putting your health at risk. They're not aware that there are safer options and that doctors are using other alternatives other than blood for people that acquire blood loss. When you have a blood transfusion, there is a great possibility of a reaction or a complication. The immediate reactions are incompatibility, acute renal failure, and also hypothermia. And then there are some other reactions, but the words are so large that I can't even pronounce them or remember them for that matter. But then there's delayed reactions such as allergic reactions, bacteria contamination, and viral infections. When your blood is incompatible, it will cause some severity, and sometimes it can cause death. But some of the very immediate reactions would be a headache, chest and flank pain, fever, chills, rigors, nausea, and vomiting. And that's if you're conscious. But if you're under anesthesia, it's very difficult for it to be noticed that you are having a reaction. And it could be, the first sign could be hypotension and show increased blood destruction. And these reactions are really considered as medical emergencies. There's also lung injury, and it's called transfusion-related acute lung injury. And what this happens, it happens in during the blood transfusion or within the 6 hours. And it is the common cause of major morbidity and death after a blood transfusion. Now, but there are alternatives to blood transfusion. There's volume expanders where you can dilute your blood when your body loses a lot of body fluids. And that way you can increase your body fluids, but it doesn't affect the number of blood cells. And there's also what they call blood salvage, where as you lose the blood, it's taken in this machine and it's recycled and put back in your body, so you don't have to worry about receiving someone else's blood. There's also blood substitutes, but most of the time most of the blood substitutes are experimental, and they're very rarely used. They're used when there's a person has a rare blood type, or for people that their religion doesn't allow them to take in blood particles. Now, in reference to the doctors, there's some pros and cons, because some doctors immediately feel like a blood transfusion is what the answer is when there's blood loss. But the doctors are starting to change, and what they do is prepare your body prior to the surgery so that your blood is built up and very little or no blood loss or new blood is required. And that's the route that a lot of the doctors are taking. And also in the bloodless surgeries, there's a quicker recovery time, shorter hospital stay, faster wound healing, and then you don't have to worry about the complications of the transfusion. So in conclusion, make sure that when you're having surgery that you consult with your doctor, that you're made aware of any alternatives to the blood transfusion that's offered, that you truly understand how everything works, because we deserve to have the right to decide what we want done with our bodies and what will allow us to have the healthiest surgeries if we have to go through a surgery. Thank you.